Hey everyone, Professor Davis here, and we are going to get into our next look at medical terminology. And we're going to look at the idea of diseases and disorders, but using diagnostic and therapeutic terms through this. So first, before we get started in some terminology, we need to make sure we understand the difference between disease and disorder. So when we're looking at a disease is a condition of abnormal structure or function. So anytime the structure of an organ or a tissue is out of whack or the function is out of whack, we would consider that a disease. Now, a disorder is a disruption of normal functions. And so it's not necessarily an abnormal, it just means that it's not doing what it should do. Okay, and so in this, it could be that it's just not working at all. It doesn't have an abnormal function, but it's just not working like it should. So sometimes things are going to be termed as a disease, and other times things are termed as a disorder. Now let's talk about the classification, though, of diseases. There's going to be a number of kind of groups that diseases can be placed into. And so if we look at the first one, infectious diseases are those caused by like a disease-causing organism. And we'll talk a little bit more about these in a minute because there's certain organisms that cause these diseases, but that's what we call them infectious. You have been infected with something and it is now causing an abnormal structure or function. We then have genetic diseases. Genetic diseases are altered or mutated genes. So the genes have been mutated or changed. So there's two terms that kind of go along with this, and it's going to be looking at congenital and anomaly. So congenital means that you're born with it and you can see it. Normally at birth, they can tell that something's going on with this genetic issue. Now, an anomaly means that there's something wrong, there's an issue, but it doesn't actually cause any like physical detectable difference. Okay, and so it's something we might watch because later in life it could cause more of an issue, but it's not something that's causing problems at that particular moment. We then also have traumatic diseases. These are going to be caused by like some sort of trauma. One of the biggest traumatic type of issues is a motor vehicle accident. Motor vehicle accidents are the biggest kind of trauma that we have coming through. You can also have anything that's like blunt force traumas, gunshots, stab wounds, crushing type of injuries. All of those would be considered traumatic type of diseases. Then you have degenerative. Degenerative means that it's going to deteriorate over time. There's a deterioration that's occurring. And this a lot of times happens with aging. As you age, things start to deteriorate and not work like they're supposed to. We then have neoplastic. Neoplastic are things like tumors or malignancies. This is going to be when cells go rogue and they're not doing what they should be doing. So they create a growth or a tumor, which ultimately could develop into cancer. So neoplastic is talking more about the cancer side. We then have metabolic. Metabolic is going to be where there's like an endocrine imbalance. This is like hormones that's in an imbalance. It's causing issues with your metabolism, which are all the chemical reactions in your body. Or it could be due to kind of a malnutrition as well. Malnutrition is going to be where you're not giving your body what it needs, and so it cannot function properly. And then the last one here is the inflammatory or autoimmune. If there's abnormal or prolonged inflammation. Now, inflammation is a normal thing for your immune system to do. The problem is it's supposed to be short-lived. And so if it's a long period, it's an abnormal response, like it's like too much of an inflammatory response, that could be an issue. Another thing is autoimmunity, where your immune system attacks you. Your immune system is supposed to protect you, not attack you, and this is part of that issue. So some other kind of things that we can use as descriptors for disease are things like organic and functional. So organic means there's a physical change that took place in the organ or the tissue. So we can physically see a difference or an issue that takes place. Now, functional is there's no physical change that happens, but there's still signs and symptoms that something is wrong. And so we can't physically see what's going on with it, but something's going on internally. This would be more of like a psychological disorder where what's going on in the brain and psychologically is affecting the body as a whole. And it's causing things to be manifested, even though there's no physical kind of trauma or issue that is present. Some other terms that come into play when we talk about diseases, the first one is idiopathic. So idiopathic is going to have the idio as the first part, and that means individual. So idiopathic is without an apparent cause. We don't know what caused it. It's kind of like an individual basis. We don't know what the underlying reason why the person developed it. Okay. And so a lot of times I would say that a disease was idiopathic if they don't know what the underlying cause is. So the next one is iatrogenic. Iatro is the first part here, which means physician or treatment. An iatrogenic disease or issue, a descriptor, is an unfavorable response to a treatment. So it's an unattended side effect to the treatment that we gave the patient. Okay, so giving them that particular treatment caused them to have a bigger issue on hand. The next one is nosocomial. Nosocomial means it's a hospital-acquired infection. So noso means disease, but you acquired it from the hospital. So this would be like if you went in for a surgery, like a knee replacement or something like that, and then you developed a staph infection while you were in the hospital. That is what we would call a nosocomial type of disease or disorder. Another set of terms are contagious or communicable. Contagious means it can be passed on from one person to the next. Some things are very contagious, right? It spreads like wildfire in a group, whereas other things are not so much. And this is where the communicable comes in. It spreads, it goes to the community, it spreads out. We also see that some diseases are what we call acute. Acute are having a short or relatively severe course, but it's short-lived. It does not last very long. So I'm not saying that it's not going to be severe or intense, because normally it is, but it is short-lived. On the other hand, a chronic disease is a lot different with the time frame. A chronic disease is going to be persisting over a very long period of time, something that you live with for quite a while. Now, when we talk about like disease descriptors, they're going to be things that kind of come into play when we look at some of our kind of base words or our prefixes and suffixes. So you have things like auto is self. And so when we talked about autoimmune, it's where your immune system attacks yourself. We also see bi or bio as part of this for life. So biology is the study of life, and this goes along with this because we do see that some diseases are caused by a biological component, meaning something that is living. Anti means against, and so anytime you use like an antibacterial ointment, it's against the bacteria. Micro is small, and we're about to look at that, where we're going to look at microorganisms, which are really small organisms. We then have emia, which is a condition that deals with the blood. And then you have gen, which is a suffix which generates. And so these are going to be things that you're going to be seeing in just a little bit, where these types of roots, prefixes, and suffix will come into play. So the next one we're looking here are the microorganisms. So we said micro means small. These are going to be things that can make us sick that are very small organisms. You have to use a microscope to be able to really study and see them. And so this is going to be a series or branch of science that we call microbiology. So they're studying small living things, okay, when we break down the word. We also see that the individual who studies this stuff is the microbiologist. Okay, so they study these small living organisms. So some of these living organisms are known as pathogenic. Now, pathogenic means that they are going to make us sick. Okay, it's this idea of this generation, this beginning of sickness due to this idea of a pathogen. Okay, so these guys are going to be what makes us sick. Now, there's a number of groups here. We have viruses, and then we can see that there are roots with this, where you have viro or virus here. Viruses are non-living, they're small, and they have to be able to reproduce inside of a living host. This is what makes them different than what we would consider bacteria or fungus, that sort of thing, is because they're not really living things. Now, you know a lot of examples of viruses. The flu is caused by a virus called influenza. We also have hepatitis caused by a virus, is the Zika virus. There's also the coronavirus. So there's lots of different viruses out there that we deal with on a regular basis. We then have bacteria. Bacteria is a unicellular organism, so they're made up of single cells. And there are three types of shapes of bacteria. You can see them here. We have the cocci, which are the circular. You have the bacilli, which are rod-shaped. And then you have the curved rods that we a lot of times call spirillum. They're more spiral-shaped in their structure. Now, these bacteria can cause illness as well. Some examples would be things like streptococcus. And again, the name tells you this is using our medical terminology. Strepto means kind of like a string, and coccus means circles. And so these circular shapes in a string is what we're looking at there. We also have staphylococcus. Staphylo means like cluster of grapes. And so that's going to be where you have these single celled organisms all clustering together, and they look kind of like a cluster of grapes underneath the microscope. So these are just some of the different types that are part of the bacteria group. Then we have the fungi. The fungi are going to absorb organic molecules, so they're going to absorb things from around them in order to eat and survive. And these guys are going to be more superficial. So when we look at fungus, they're going to be more superficial in their infections, and this is going to be using these root words like fungi and also myco. We're going to see mycoses is going to be fungal type infections. Now these include things like Candidemia albicans. This is also known as thrush when it happens in your mouth, but it is a type of like yeast infection. We also have athlete's foot and ringworm. These are just a few examples. The last group on here are the protozoa. Protozoa are animal-like structures. They're not actually animals, but they're kind of like animals in how they behave. They are going to cause some diseases, things like malaria. They are passed on through mosquitoes to us and cause problems. There's also trichomoniasis, which is going to be a sexually transmitted disease that is also a protozoa. All right, so this brings us to some of our pathologies that we want to take a look at. And again, we have some terms that are important here. You have things like malignant and benign. So malignant is going to mean that it is a type of tumor that invades surrounding tissue. Malignant tumors are the more dangerous. They're the ones that we also consider as cancer or cancerous. So benign tumors can also cause problems as well, but they do not spread to the surrounding tissues. They're more encapsulated. They're in a capsule, and so they can put pressure on the surrounding tissues, but they're not invading the surrounding tissues. Now, tumors are going to be where we have an abnormal growth of cells. These cells are going to be in large amounts where they should not normally be in those amounts. And we see that we can have a couple of terms or roots that deal with this. So you have the root onco on there, and then you also have oma that can be added as a suffix when we're talking about types of tumors. We also then see that we have actual cancer. Now, when we're talking about tumors and cancer, they are actually part of a umbrella term called neoplasms. Neoplasm just means abnormal growth. And if we give some more of these words where we say it's a malignant neoplasm, that's going to be what we consider cancer. And so with cancer, you also have some roots here where we have just the carcino, and then you also have the cancer, okay, as part of that. Now, some examples of some terms that are going to be used a lot of times when we're talking about diseases are listed here. You have SIL, which is like a herniation or hernia. And so when you hear of somebody who has what we call encephalocele, that's going to be where they have a swelling or herniation that's taking place of the brain, where a piece of the brain is herniating into an area that it shouldn't go. We also have anemia, which is a blood condition, and so we can say if somebody is anemic, they have anemia. Okay, so anemia means they don't have enough blood. That's what we're looking at. We also can see that you have the IA, when we're talking about the condition, where it's just the end of that word. And then you also have stone, which is litho or lith. And then phobia. Now, phobias, guys, are an irrational fear. And you've heard of these before, like arachnophobia, an irrational fear to spiders, or claustrophobia, which is an irrational fear to small spaces. Those are all going to be part of that particular group of using that suffix. Some other common suffixes that come into play when we're talking about diseases, of course, is itis, which is the inflammation. You can add this to all kinds of stuff anytime something is inflamed, like appendicitis, colitis. Anytime that itis is on the end, it's an inflammation. We also have a lot of prefixes that deal with pertaining to. They're all listed here. There's a bunch of them. So you could have things like cardiac, neural, mammary. Those are all going to be pertaining to those areas. So cardiac is pertaining to the heart. Neural is pertaining to the neuron or the nerve. Mammary is pertaining to the breasts or the mammary area. And so when we look here, this is going to be where we use a lot of those suffixes. We then have the suffix of the enzyme ACE. Anytime a word ends in ACE, it's a good idea or a good indication it is an enzyme. An opposite of this that you need to be careful with is OSE, O-S-E. That's going to be a type of sugar. So if you have lactose, that is a sugar, but lactase is an enzyme that breaks down that sugar. All right, so the ACE on the end is the enzyme, OS is dealing with a sugar. All right, and so this is again just giving us a little bit of an idea of some of the suffixes that are going to be very common. So you're going to see some other suffixes that come into play, things like megalo or megaly, that means large. So a megaloblast is a very large type of cell. Cardiomegaly is going to be where the cardiac muscle is enlarged or big. Patho means disease, so if it's pathogenic, it's going to be causing disease. Neuropathy is going to be where it's a disease in the nervous system or the nerves. Plasto is like repair, so if you have plastic surgery, it's to kind of repair that, or a rhinoplasty is to repair the nose. All right, so this is just giving you a few more examples of some terms that come into play when we're talking about some of those suffixes. Also in this particular chapter, it looks at combining forms for color. So we have some of these root words that deal with color in a medical terminology. So when you see albo, albino, leuco, those are going to all deal with white. And so albinism means that it's going to have no pigment, it'll appear white. Leukocyte is a white blood cell, because cyte means cell. And so that is what's used there for that color indication. You also have chloro, which is for green. So when you hear about chlorophyll or chloroplast, they're green. Cyano is blue, so cyanosis is going to be a bluing that occurs in the individual, especially when you're not breathing and you start to see blue around their lips or in the beds of their fingernails. You would see that is a blue color. Erythro is red, so an erythrocyte is a red blood cell. Okay, so you have erythro as red. A melano is black, so when we talk about a melanocyte or melanin, it's going to have a black color. So xantho is yellow, so you can have xanthoderma where your skin is yellowing. We also call that jaundice. And so there are some color terms that come into play when we look at medical terminology. All right, so now let's talk about some general diagnostic terms that we need to take a closer look. So although these words are not actually formed from word parts like we're going to see in this chapter, they are very important for us to understand and know what they mean. So diagnosis is the identification of a disease or a condition, and they do this by doing the scientific evaluation of physical signs and symptoms of the patient. All right, so signs and symptoms are a little bit different. We'll talk about them in just a second. We also need to take the history of the patient, doing some tests, some different procedures. Those will ultimately all lead us to a diagnosis. Now, after we have a diagnosis, this also brings us to what we call a prognosis. Prognosis is the predictive outcome of the disease. What's going to happen? What are the chances that the patient's going to survive it? Is there any long-term damage? That's going to be the prognosis for the patient. Now, going back to signs and symptoms, we do need to know the difference. Signs are definitive evidence of an illness or disorder or function, and so those are objective. Signs are going to be things that you can actually see, you can observe. So this would be like things like taking their blood pressure or their temperature, looking at their heart rate. Okay, those are going to be things that can be seen in that sense. Symptoms, on the other hand, are subjective. They're the information that the patient gives you. It's the evidence of like how they feel. Pain scale is actually a symptom, not a sign. Because the patient has to tell you. That's why we go in and say, oh, what's your pain level from 0 to 10? 0 being no pain, 10 being the worst pain you've ever felt. Whatever number they give you is subjective. Because you can have two people with the exact same illness, the exact same problem, same degree, and one person's pain level may be higher than the others because it's based on their perspective. It's subjective. Now, with this, it's really important that we look at things like signs and symptoms in a physical examination. When we do a physical examination, this is normally abbreviated as PE, we need to look at the vital signs. We also need to look at the different techniques that we utilize for that. Okay, and so this is going to be things like vital signs would be respiration rate. So we want to see what their breathing is like. We also want to take their pulse. And of course, then their body temperature. Those are easy ways to give us some vital signs that we can use. Now, those aren't all of them. We can also take their blood pressure. Okay, there's a lot of different things that we could use for the vitals. Now, for techniques need to be where we are evaluating the patient, using different techniques in order to find out what's wrong. So the first thing when we're doing a physical exam is, of course, inspection, where you inspect the patient. It's where you would use your eyes in order to look for different issues that you might see. This could be changes in the color, changes in their behavior, different things like that. We also see that we can use palpations. Palpations is when we have the examiner feels the texture, the size, the consistency, the location of certain body parts with their hands. And so they palpate an area. This is a lot of times where they may push on your belly and that sort of thing. Or when you go to the doctor and they want to palpate all of your lymph nodes here to see if there's any swelling. We also have percussion. Percussion is where the examiner is going to tap area. So they might tap your belly. They may tap like for your reflexes, things like that. And then we have auscultations, which is where we would listen. All right, so this is where they would use like a stethoscope to listen to your heart, to listen to your lungs, that sort of thing. They may even put it to listen to your belly, but that's going to be where they're listening for sounds. All these things put together help us with the physical examination. So when we're doing diagnostic procedures and we're trying to figure out what's going on with the patient, you're going to find that there's a lot of common suffixes that come into play here. Some of them are going to be based on that physical examination we talked about, where you're looking for signs or symptoms, like when you're seeing algia, which is the suffix for pain, edema, which is the suffix for swelling. You may have emesis that deals with vomiting. All right, so we have a lot of these terms that can be used when we talk about like signs and symptoms. We also have things like for procedures where we're going to see some of these suffixes come into play. These include things like if you put gram at the end of the word, it's a record. So an angiogram. When we look at that, we also have a graph, which is an instrument used to record that. All right. And so when you go in for say an EKG, where it's an electrocardiogram, they would use the electrocardiograph in order to take and perform. So they have that record. We also have the graphy, which is the process of recording. And so you need to be really careful when using these terms because they all sound very similar. They all sound very similar, but they have these slight differences that make them mean something different. We also have meter, which is the instrument used. You can also see scope, which is the instrument used for viewing, like an otoscope, stethoscope. You also have a scopy, which is the process of visual examination. So you need to pay close attention to those subtle differences where you had a Y to the end, which makes it more of the process of examination versus the instrument that does the examining when you just have it without the Y. So you have to pay attention to these subtle things. So when we look at this, what do some of these words maybe mean? So when you have like echocardiography versus an echogram, these are going to use sound waves in order for you to have a picture or be able to then record it with that idea of the instrument or the process. Sonography, ultrasonography, echography, sonogram, ultrasound. Okay, those are all going to be parts of that, breaking them apart. This brings us to a number of different kind of examples of things we can use for diagnostic procedures. Now, some of these are non-radiological, meaning we're not using radiation in order to get them. These would include things like biopsy, cannula, a catheter, electrocardiography, and endoscopy. Those are all going to be things that are instruments that are used without the use of actual radiology. Okay, when we look at that. Now, the radiology stuff is going to start there with the radiographs. We can use a contrast imaging and fluorescence that's used. Sonography, nuclear scans. We can use a position emission tomography, which we call a PET scan. They can do a magnetic resonance imaging, which is an MRI, or a computed tomography, which is a CT. So you're going to notice abbreviations also come into play here, but you could break down the words to kind of see what they are doing. But they are going to be taking types of pictures when we're looking at that, giving you a record of what is happening. All right, so these are just some examples of some diagnostic procedures. This brings us then to the therapeutic interventions. Once we have a diagnosis, we want to then do some of our treatments. And when we're dealing with treatments, guys, there's a number of different things we can use that are non-surgical based. So these are going to be some of the root words that you would see with non-surgical types of treatments. So you have the or what we call analgesia. That's going to be like a painkiller, like a over-the-counter type medication. You also can have chemo for chemotherapy. This is used where we're going to use a certain kind of medication, a lot of times to treat cancer. Anesthesia, when we look at this, anesthesio, if we're looking at anesthesia, it's to kind of bring things down, bring down your awareness. And so it puts you, when we talk about general anesthetic, it puts you out, it puts you to sleep. We have toxo or toxio. That's going to be a toxic dose or toxin. There's also toxicology, where you would then study poisons. And then you also have therapy at the end. So radiotherapy, chirotherapy. Chirotherapy is where you treat it with cold. Thermotherapy is treatment with heat. So if you use like a heating pad, those would all be non-surgical versions. On the surgical side, we have some of these suffixes that come into play with surgery. You have synthesis, so like an amniocentesis is where we're going to remove a small amount of amniotic fluid. You have ectomy, pexy, which is like a surgical fixation. So you're fastening it into a fixed position. You then have raphy, which is like suturing. We're putting like stitches in. You have stomy, which is the formation of an opening. So like a colostomy is where they're going to put an opening or a hole through the body to the colon, okay, in order then to bypass parts of the colon that are causing problems. And so these are all surgical when we're talking about them, okay? So pay attention when you're going through and you're looking at your charts, which ones are non-surgical based type of treatments or interventions versus which ones are surgical. We then have our pharmacology. And so when we're looking here, remember, pharmacology is where we are focusing in on the idea of the medications, the drugs in that sense. Pharmacotherapy is where you're looking at medications as that therapy. When we see here, there are a couple of things we want to take into account. You have OTC, which is over-the-counter drugs. Those are the drugs that you can end up getting when you go just to the regular grocery store, things like that, things like Tylenol, Motrin, any of your like allergy medications like Allegra and Claritin. Those would all be OTCs, over-the-counter. Prescription drugs are a little different. Those are the ones you have to actually have the prescription for. You have to go to the pharmacy, they prepare them, and then give them to you. And so there is a distinction there. Now, sometimes over-the-counter drugs become prescription drugs if you need a higher dosage. And so that can be also a kind of crossing over that you see there. Now, when we talk about pharmacology, there are a lot of abbreviations that come into play. So AC here is anti-cybum, which just means before meals. And so you're going to notice that you have the ad lib or PRN. Those are going to be freely as needed. So when you need them or as the occasion rises, when we're looking at that. AQ is going to be where it's with aqua or water as part of it. BID, TID, and QID stand for twice a day. So the BID is by, so twice a day. 3 times a day is the TID, and then the QID is 4 times a day. NPO is nothing by mouth. A lot of times when somebody's going to go into surgery, we would put a sign on there that they're NPO. Don't give them anything by mouth before they go into their surgery. PO is an abbreviation for orally, so you're going to give it to the patient orally. PRN is as needed, and then the Q is every. All right, so it might be like every hour, every 2 hours. They may put those abbreviations in. And so these are going to be things that are going to be important, especially when we're charting, if you're going into the medical field where charts are a big part of this. Now, as a little wrap up here, we want to look again at some of those abbreviations. So BP, guys, remember, is blood pressure. ECG is an electrocardiogram. And sometimes they also call it an EKG, even though the K isn't there, it's actually a C. So it's an electrocardiogram. MIS is minimally invasive surgery. And so that's going to be like a minimal, that might be where they're using laparoscopically, where it's small incisions, that sort of thing. RX is a prescription. And then STAT is immediately. Now, these are not all the abbreviations. You have a really good chart in your book that goes over them, but you're going to see these abbreviations kind of over and over again. Now, I do have a little area here that says use caution with some of these types of suffixes because they are very similar in how they are used, or you think that they are interchangeable, but they're not. So remember, I've already hit on that ACE and OS. ACE is an enzyme, OS is the sugar. The idea of gram, graph, and graphy. Remember, they have slight differences, which gives them also slightly different meanings. So like IA is talking about the condition, but IAC is the person suffering from that particular condition. So phasia is the swallowing part, whereas phasia is the speaking part. Again, still dealing with the mouth, but there is a difference there. So plasia is the formation, whereas plasty is the surgical side. So here with Raj, Rea, and Rhexis, the Raj is going to be where you're talking more about an excessive bleeding, where the Rea is going to be like a flow or discharge, and the Rhexis is going to be more of a rupture. And so again, they're very similar, but they are different enough, those subtle issues. We also have the tomy and stomy. Tomy is where we're talking more about an incision, so cutting through the tissue, whereas stomy is an actual hole. Okay, and so again, use these with caution. Pay attention to their endings of these with these suffixes, because it could change the meaning. So make sure you know the difference. Sign versus symptoms. Signs are objective, symptoms are subjective. Diagnosis versus prognosis. Diagnosis is the identification of the disease. The prognosis is the predicted outcome. Iatrogenic versus idiopathic. Iatrogenic means it's an unfavorable response to a medical treatment, whereas when we look at idiopathic, it refers to not knowing the apparent cause of a disease. And then we have incision versus excision. Incision is cutting into, excision is cutting out or removal. All right, so again, pay attention as we go through there, looking at these different subtle things that are part of this chapter. All right, and so yeah, it's tough as you're going through this and you're looking at the different meanings, but if you'll pay closer attention to them now, it's going to help you in the long run. Now, this kind of wraps up a little bit of the intro here to this particular chapter. If you do have any questions, please let me know.